Are you a hospital owner or planning your dream hospital and worried about NABH, Ayushman Bharat, and other hospital challenges? Then this CEO Masterclass is for you. Will your hospital survive in new era of Ayushman Bharat? Is the main question, and I will discuss in detail this CEO Masterclass. I am Dr. D.K. Rai, Future Ready Hospital Movement founder, hospital transformation strategist, hospital planning specialist, and revenue architect, running a future ready hospital movement at present. And we help hospitals in protect revenue, build quality, and grow sustainability. In this masterclass, I will discuss it in detail along with Ayushman and NABH, revenue protection, and new growth streams for hospital. First, Ayushman Bharat के लिए 50 bedded NABH जरूरी. This is not a rumor. Now, the hospital impaneled with Ayushman must act now so that they could save their Ayushman empanelment. What are the new mandatory requirements? And what are the questions of hospital owners? Is my hospital ready for NABH? Means if your hospital is not prepared, you can plan for that. And the question is that what if I am not going for NABH accreditation? If you are not ready for NABH full accreditation, you can plan for NABH entry level to save your Ayushman empanelment. And is 50 bed mandatory? For IENT, it's not mandatory because there is no bed requirement. Then what top 7 mistakes that are silently killing your hospital growth? Number 1 is the treat NABH as paperwork. Most of the hospital owners treat NABH is the paperwork, but it is a business operating system. Install it as soon as possible. It will give 40 to 50 lakh rupees annually in various forms. No CEO involvement in transformation. Usually CEO delegate not only operation but strategy also so that transformation is affected. Next is no monthly revenue dashboard. Hospital owners, if not having revenue dashboard, not tracking key performance indicators weekly, then they face challenges and losing 5 to 10% of revenue in a revenue leakage form. Next is no internal audit culture. They are not doing internal audit to get the shortcomings before any outside audit, causes claim rejection and NABH non-compliance. So that you should do at least weekly internal audit. You and your hospital becomes immune for outside compliances and inspections. No patient retention system means 60% of patient coming to hospital never returns back in follow-up because you don't have follow-up system, one-time conversion, patients visits and never return back. 60% of patients are in this category. Next, zero recurring revenue. If you don't have any recurring revenue model, then you will be 100% dependent on new admissions for the revenue only. And no leadership war room. You are not sitting weekly or monthly basis to plan your strategy for your hospital, and it will become firefighting mode. When the problem arises, you will try to solve that in spite of proactively solving it. Then healthcare in India is entering in a new era. Are you ready for that? In 2000, beds are filled. Any patient at any price are admitted. But in 2015, the insurance era came. And then Ayushman cashless compliance is the main driver. In 2020, quality mandate means NABH documentation and standards are become compulsory. And in 2024, digital health, AI, IoT and remote care, database care become more important. And in 2026, value-based care, outcome-based care, future-ready model become more popular. Hospital that thrive in 2026 to 30 are built right now and decisions will be taken today. The hospital of 2030, how it will look like. 2 hospitals, same city, same doctor, completely different futures. One traditional hospital and another future-ready hospital. In 2030, if traditional hospital, still model will be beds and admissions, and in future-ready, lifetime patient relationship model. Traditional hospital will focus on episodic treatment, and future ready hospital will focus on population health management. What is the trend of the population and manage accordingly. Then revenue base will be the fee for the services. The service which hospital will give will get the fee for that. But in future ready model, recurring revenue stream means various programs, a recurring revenue system will be developed and patient will pay each and every month to hospital. Then traditional hospital care will be reactive and wait for wellness. But in future ready model, preventive and predictive. You have to take proactive actions. Then traditional hospital, most of the systems will be manual and paper based. But in future ready hospital, it will be AI assisted and digital first. Patient in traditional hospital, one time visit and disappears, never return back. But in future ready hospital, enrolled, monitored and retained for 3 months or 6 months. Then in traditional hospital, compliance burden considered as NABH, and in future ready hospital, it is taken as the business operating system. A hospital owner, 15 years in practice, met with me. He has 80-bedded specialty hospital in North India. He told that, Doctor, I built this hospital for my children, but I am worried that today I don't know whether they will want to run it or not. Problem is that they are worried that he may join the corporate hospital in spite of running his own hospital. And that conversation changed my view, and I have started future ready hospital movement, because there the challenge was never just NABH, not challenge was the revenue, because the hospital was running successfully, having renowned in that area. But problem is that building hospital that could be handed to the next generation is the main issue. And this is why it drove me to create the future ready hospital system. Now the 4 threats destroying hospital revenue right now. First threat is the compliance risk. Each and every hospital owner could not sleep at night because of compliance risk. It may be NABH, hospital registration, pollution, fire, MTP, PNDT, AERB, but they are worried about the compliance. And new 2026 rules tighten further in Ayushman empanelment. Next challenge is the revenue leakage. 10% of monthly revenue lost silently due to documentation gap, billing error, rejected claims, money earned but never collected in the bank. Next is the claim rejection, incomplete discharge summaries, wrong codes, missing signature, and every rejection is the lost revenue. 23% average Ayushman rejection rate in small and medium hospital, and overall rejection rate is 12%. Then rising competition. Corporate hospitals are aggressively entering your city, and differentiation is now survival. So 3 times corporate chains expanding tier 2 and tier 3 cities, so that you have to be prepared for that competition also. Every threat is also a hidden opportunity, because in Newton's third law, every action has equal and opposite reaction, so that 4 massive opportunity hiding inside every threat. Number 1, revenue recovery, that is 12 lakh to 1.5 crore per year, recoverable from claim fixage alone, systematic claim management, documentation excellence, and rejection appeal protocol. Next is the trust leadership. It will generate 3 times more referral. If you will get NABH, patient will trust more on your hospital, and NABH as a market differentiator, not as a compliance or documentation burden. It will help in corporate management also, and premium patient perception will improve, and premium patient will be attracted to your hospital. Next is the system advantage. You will get a proper system, so that you have to do 40% less rework. Standardized patient care will be done, trained accountable teams will be there, audit ready always. Then new income streams. You could generate 6 to 10 lakh rupees per month new income streams in your hospital by new non-Ayushman recurring revenue model. It may be diabetes center of excellence, chronic patient care, metabolic health program, PCOD, weight loss program, and antenatal patient care, recurring revenue, or joint pain patients program. Then future ready hospital maturity model. What is the future ready hospital maturity model? Hospitals will be of 6 category. First will be in survival mode, just keeping doors open, no system, and working on firefighting daily. And second is the compliance hospital, just basic regulatory requirement they have, and they are chasing for NABH and Ayushman empanelment, utilizing their 35% capacity. Then third is the quality hospitals, having standard operating procedures in place, staff trained, consistent patient experience, and they are utilizing 52% of their capacity. Then fourth is the operational excellence. Key performance indicators tracked in that hospital, revenue optimized, claim rejection under control, and 68% capacity utilized by those hospitals. Next is the growth hospitals. They have new income streams, digital patients, and brand recognition in city. And they are utilizing 84% of their capacity. And sixth is the future ready hospital, full ecosystem, AI assisted, utilizing 100% of capacity. But unfortunately, most Indian hospitals operate between level 2 and level 3. That is, compliance or quality hospitals, and future ready hospitals are very few pan India. Then the future ready hospital movement bridges this gap. Next is the CEO Hospital Intelligence Dashboard. You have to score your hospital on 1 to 10 parameters on each pillar. Number 1 pillar is the leadership and vision. Means, do you have 3-year hospital strategy? Score and mark your hospital on the out of 10. Then second is the revenue and finance. Do you know your exact monthly leakage? How much percent revenue you are leaking each month? Score on out of 10. Then quality and NABH. Are you audit ready today? If inspection happens today, are you prepared for that? Mark on the basis of 10. Then digital system. Do patient receive digital follow-ups? Next is the claim management. Is your rejection rate below 5%? Then you can mark 10 marks. Then people and culture. Do staff follow SOP consistently? And then operation. Is your average length of stay optimized? On that basis, you can assess your hospital operation. What is the status of your hospital? Maximum score will be 70, and below 42 needs urgent action. 43 to 56 is the growth ready, and 57 to 70 is the future ready hospital. The biggest mindset shift in this masterclass, that is, NABH is not an accreditation. It is your hospital business operating system. I will explain how. Old thinking that NABH is the certificate on the wall, but new thinking that NABH is business growth engine. That in old thinking, it is considered a one-time compliance exercise, and in new thinking, it is a permanent operating system. In old thinking, burden on doctors and nurses. But in new thinking, it is considered staff empowerment through clarity. In old thinking, it is considered as expensive paperwork. In new thinking, revenue protection infrastructure. In old thinking, it is considered something regulatory demand. But in new thinking, competitive market advantage. If you have to survive in the market, if you have to lead the market, then you must get NABH accreditation certificate. In old thinking, it is considered 3 months of pain, then forget the NABH. But new thinking is change, culture of accountability and safety. In old thinking, it is a consultant's project, not mine. But new thinking, that my hospital highest value asset. So that you could consider it as a business operating system, not a burden or a compliance only. Then future ready hospital framework, 8 engines of transformation. First engine is the governance, second is the leadership, third is the growth, fourth is finance, fifth is operation, sixth is digital, seventh patient safety, and eighth is the quality. Every hospital is different, and one strategy does not fit all. So that first, urgent in category 30 to 50 bedded hospital, having focus on survival to compliance category. They are at present in survival and trying to shift in compliance category. Ayushman in panel, basic NABH and claim system. Second is ready to scale, 75 to 150 bedded hospital. Their focus is compliance to quality. I have explained earlier 6 categories of hospital, and in this compliance hospital will shift to quality hospital. Then full NABH, revenue optimization and chronic disease center. Next is the growth phase, 150 to 300 bedded hospital. Their focus is quality to excellence, digital system, corporate empanelment, and leadership. Next is differentiation. For a single specialty hospital, focus on differentiation, not on competition, so that niche dominance like super specialty hospital, eye hospital, ENT hospital, ortho hospital, cardiac hospital, and focus on NABH and outcome metrics and referral network. Then next, if you are planning for a new hospital, means greenfield hospital, then you have to build it right. Future ready by design, digital first, and NABH from day one. Means you have to not only hire a architect, you have to hire a hospital architect having background of designing hospitals. You have to add legal expert, hospital business expert, doctor with hospital planning background, NABH expert with hospital planning background. A whole team will design because hospital is a super specialty structure and team of super specialists should design it properly. Otherwise, you have to build, then tear, then rebuild. Cycle will be happen due to compliance, NABH, and business aspects. So that you have to build it right now. Then another is the rescue plan. If your hospital is struggling, then you have to focus rescue and revive, and revenue recovery focus should be there, team culture should be developed, and occupancy strategy should be maintained. Then the CEO strategy clinic identifies which segment will work for you. Then new recurring revenue stream. India's diabetes crisis. 10 crore people are suffering from diabetes. That is why India is told as diabetes capital of the world, and 4.8 CR pre-diabetes patients undiagnosed, and each diabetic patient is spending annually 2.9 lakh rupees per year on their diabetes treatment and their management. In a city of 5 lakh people, you are having 55,000 diagnosed diabetics. Your hospital sees maybe 500 of them per year. But what about 54,500? They are spending monthly consultation and lab 800 to 1500 rupees. Then CGM device and monitoring each month 2,000 to 4,000 per month. Diet and lifestyle coaching 500 to 1,200 rupees per month. And annual screening package 3,500 to 6,000 rupees. So that these amounts are spending diabetic patients, but check how much are you getting. Then chronic care revenue engine. That for diabetes and pre-diabetes, you have to make hypertension clinic, obesity and weight loss, PCOD and hormonal health, and fatty liver and metabolic patients, and executive health programs, and family screening. These are the massive opportunities where you can help the society and make your hospital recurring revenue also. Combined monthly recurring revenue potential is 6 to 12 lakh rupees per month by non-Ayushman, non-IPD, and it will start from month 1. Then hospital transformation flywheel. Once spinning, it never stops. First is the NABH and quality. Patient choose over your competitors because you are maintaining the quality, you are the NABH accredited. Next is the patient trust. If patient trust you, it will refer other patients, it will appreciate you, it will be your mouth-to-mouth advertiser. Then higher will increase your occupancy, you will get more revenue, then you could have more investment for developing the system in your hospital, and your patient will get better experience. And vicious cycle will be started which never stops. Then why most hospitals fail to transform? It has nothing to do with NABH. Most hospitals could not transform not because of NABH, but other reasons. Because leadership problem, CEO delegates transformation to junior staff, activity trap, busy with day-to-day operation. Hospital leaders confuse activity with progress and meeting replace decisions. Then no data culture. You cannot improve what you do not measure. Most hospitals have no real-time dashboard for revenue, quality, and patient outcomes. Next is the solo mentality. Doctors, admin, nursing, and billing work as a separate island. They never work in a team approach in a coordinated manner so that transformation could not happen. And no accountability system. Plans are made, reviews are missed, and no one is held accountable for non-implementation. Then the 90-day transformation system of your hospital, what you have to do. First, hospital audit, CEO interview in week 1, current state mapping. In week 2, diagnose the problem or how much revenue leakage, what is the maturity score, what is your hospital category, and what are the gaps. In week 3, design, custom transformation blueprint and 90-day roadmap. In week 4, deploy, means you have to make standard operating procedures, templates, dashboards, all live in week 4. And week 5, all staff trained on protocols, doctors on documentation. Then week 6, measure. First, key performance indicators reviewed, claim rate, occupancy and patient satisfaction assessed, then improve, refine based on data, fix what is working and what's not, then audit. Internal mock NABH audit to confirm the readiness. And in 9 to 12 weeks, new income stream, chronic disease center, and full ecosystem developed. Then future ready hospital roadmap, 6 months to transformation. Month 1, assess, CEO strategy, hospital maturity score, revenue leakage, audit, NABH gap analysis, Ayushman compliance. Month 2, SOP library creation, claim management system so that your claim should not be rejected, staff training module, documentation template, and key performance indicators dashboard setup. In month 3, what we will do? NABH standards live, claim system deployed, staff protocol active, patient safety system and revenue tracking will be live. In 4th month, what we will do? Rejection rate review, process refinement, leadership war room, patient feedback loop, financial rebalancing. In 5th month, diabetes center launch, family screening program, CGM and lab packages, digital patient journey, and referral network building. In 6th month, full metabolic ecosystem for PCOD, obesity, diabetes, pre-diabetes, for corporate empanelment, NABH full accreditation of the hospital, and 8 to 12 lakh per month new revenue stream generated, and future ready hospital certified. Why 150 plus hospital leaders trust Dr. DK? 20 plus years of experience, 150 plus hospitals transformed, 5 states covered, India-wide impact, 5 plus books published, hospital strategist and hospital planning expert, governor of UP recognition for healthcare book on corona, future ready hospital movement founder, India's hospital transformation platform, then author, Smart Hospital and NABH Accreditation Made Easy, Make India Diabetes Free Mission, founder, then Green Smart Hospital Initiative. What hospital leaders say about Dr. D.K. Rai and HospitalTraders? We admire your valuable contribution in NABH, NABL accreditation, business, promotion, hospital expansion, hospital management by Dr. Anil Goyal, Medical Director and MLA Delhi, Goyal Hospital and Urology Center. Then Dr. Jagjit Ahuja of Panipat, Ahuja Hospital. HospitalTraders team members guided us very well through our NABH preparation period. They are well conversant with their job. The transformation was complete, professional, and exactly what our hospital needed to grow. Then Vedanta Hospital, Bareilly, from planning to NABH accreditation, 150 plus hospitals transformed. Case study, 70-bed multi-specialty hospital. Challenges, no NABH, high claim rejection, no structured growth plan. Goal was NABH accreditation, revenue optimization within 90 days. Then first we diagnosed the problem, full hospital audit, revenue leakage, 3.2 lakh per month identified, system build, documentation SOP, claim rejection management, system deployed, then NABH achieved accreditation done in 6 months, claim rejection rate 22% to 4%, and new specialty launched diabetes center added 4.5 lakh per month recurring revenue. Then we don't consult, we install. We install CEO dashboard of having 7 pillars, hospital intelligence dashboard live every week, install revenue intelligence, real-time tracking of leakage, claims, recovery, and new streams. We install hospital flywheel, self-reinforcing quality, trust, revenue growth system. Then we install leadership war room and digital patient journey. Then future ready hospital maturity index. 4 types of hospitals. First, danger zone, compliance struggler. They are having high NABH risk but low revenue, needs urgent compliance and revenue rescue. Next is the hidden gem. They are maintaining high quality but generating very low revenue, very less patients. New income stream, growth activation. Then at risk revenue players, low quality, high revenue, needs quality system and NABH to protect gains. And then future ready hospitals, high quality and high revenue, sustainable growth engine, fully transformed. There will be 2 types of hospitals in India. Number 1, those that were acquired and those that were adapted and late. First category could not adapt to new compliance rules. Second, which NABH becomes their competitive advantage. First is the revenue stagnated or fell every year, or in second category, revenue grew by 40% with chronic care engine. First category, lost patients to better organized competitors. Second, became the hospital brand in their region. First is category, no digital system, no recurring revenue. Second is the digital first, AI assisted, patient retained. Then leadership burned out, running the same cycle. And in second category, CEO as a system, not a burden. Then where to start? War Room CEO Clinic. Your 90-day action plan, roadmap, WhatsApp to get it. What every CEO receives in Future Ready Strategy Clinic, Future Ready Hospital Score. Benchmark your hospital on 7 pillars. Know exactly where are you stand versus ideal. Then revenue leakage snapshot. Identify monthly revenue escaping through documentation, coding, and claim gaps. 3 growth opportunities for your hospital. City-specific income stream you can activate. And then 90-day hospital roadmap, your personalized month-by-month plan, compliance, revenue, quality, and growth. Then CEO intelligence dashboard, your hospital's KPI visualized. Then NABH and Ayushman readiness snapshot, current compliance status versus required risk level priority action. Then executive priority metrics. Top 10 actions ranked by impact show effort. Top 10 actual rank by impact versus effort. Know exact what to do first. NABH checklist, Ayushman, SOP template, revenue, KPI dashboard, and CEO scorecard will be given. WhatsApp War Room and book now